Hi, my name is Jim Ducharme, and I'm CTO here at ClearDATA. Today, I'd like to talk about one of the most consequential attack vectors facing healthcare today and keeping their public cloud infrastructure secure, and that's identity. Identity attacks continue to dominate the list of root causes of healthcare systems and data compromises. The Change Healthcare breach is simply one of the latest examples in a long list of breaches caused largely by the weaknesses of identity controls. That breach was reported to be about 2.5 times the size of the next largest healthcare breach in history, resulting in a compromise of over 190 million patient records. The unfortunate reality is that many of these breaches could have been prevented or mitigated quickly with the right technical controls and oversight. In the case of the Change Healthcare breach, not only were those 190 million patient records stolen, but the attack also caused major disruptions in the healthcare industry as a whole. Patient care and business processes at thousands of U.S. hospitals and medical practices were affected for weeks on end. So even those healthcare companies with good security postures that did all the right things found their businesses disrupted due to this third-party compromise and the weakness of identity controls. So what can we do? There's so much to unpack about the risks healthcare companies face in the wake of these breaches and the lessons we can learn from them. So today, let's focus on that consequential attack vector of identity and some of the practical steps that you can take to ensure that to drive your strategy on protecting your infrastructure and the PHI that's resident in it, especially from identity attacks. So I'm going to talk about four ingredients I take to dealing with just about any type of risk in your organization and how to remediate it. And those four areas are assess, control, monitor, and govern. So let's break down each one, especially as it relates to identity. Assess, number one. There are many security and regulatory frameworks prescribing best practices for ensuring a secure, compliant, resilient cloud. These frameworks can be daunting and hard to interpret from book and verse into actionable insights and creating effective technical controls. To properly assess your security posture as it relates to your identity, you need a solution that helps identify gaps and provides prescriptive guidance on how to mitigate them. At ClearDATA, we've created the cyber health platform with hundreds of what we call safeguards that do just that. Specifically for identity, we have safeguards targeting identity control weaknesses across AWS, Azure, and GCP, offering guidance on strengthening your identity posture through technology configuration and processes. So take that assessment approach first. Next, control. Once you assess, you can build your plan of attack to strengthen your posture against identity compromise threats. Some controls may include proper cloud resource configuration to protect against inappropriate access, effective credential management policies, technical controls like MFA, key management, even backup solutions to help ensure resiliency. The safeguards we mentioned, that I mentioned earlier, not only assess your identity security posture, but also have some remediating capabilities that are automated. So combining these safeguards with our ClearDATA Managed Services team, which has over a decade of experience in helping other healthcare customers design, deploy, and manage appropriate technical controls, that can ensure an effective control of your identity risks. Third, monitoring. Despite the best of controls, the securest of doors, the securest of windows, attackers eventually seek new weak spots in your infrastructure to infiltrate and gain access to that valuable PHI data. This brings us to that third ingredient, monitoring. Just like when you secure your house with locks and security cameras, you need a couple technical controls on your cloud infrastructure to ensure effective monitoring, detection, and response processes. Having a robust set of monitoring capabilities to filter the noise out and focus on impactful events, along with clear incident response procedures, is crucial. At ClearDATA, our advanced MDR services help monitor threats in the healthcare industry as a whole, identifying those that are applicable to your environment, and providing investigation remediation capabilities to thwart the latest attacks. And lastly, govern. Finally, protecting yourself against identity threats is not a set and forget exercise. Ensuring an effective strategy against these attackers and maintaining control effectiveness requires good governance processes. This includes proper credential management like regular key and password rotations, regular reviews and updates to incident response procedures, identity governance processes to understand who has access to what to your PHI and is that current, especially as it relates to third-party access and employee access, and even systems access. What systems are talking to what systems, for example. And adapting those controls as application services and attacker approaches evolve. So very quickly, those are the four sort of high-level ways to approach thinking about how to make sure that you're secure, compliant, and resilient to the identity attacks that are out there today. I hope you consider how well equipped you are with these four ingredients for a good identity security strategy. If you have any questions or believe that you could benefit from our expertise in helping hundreds of other healthcare customers implement and manage effective strategies, please visit our website at cleardata.com to learn more about what we have to offer. Thank you.